Hi guys, this is Dr. Anokwute. I just wanted to share a case that I saw in the clinic today. Now, this was a an elderly male, a gentleman, about 86 years old, who came to me. He just wanted to establish care, right? He hadn't seen a doctor, a sleep doctor, in so many years. His most recent study was in 2016, so about 9 years ago. Okay. Listen to how severe his sleep apnea was. He stopped breathing 74 times an hour, okay? Really bad sleep apnea. And then he had not seen a sleep doctor since then. And this is 9 years and counting. And I bring this up because for providers, if you have a patient who's had sleep apnea, ask them, how are you doing? Have you been followed by a specialist? Because it's good for someone to look at those numbers from the PAP machine and make sure that the patient is well managed for sleep apnea. Now, I pulled the data of the PAP machine download, and guess what I found? Patient has been having residual sleep apnea events, not just obstructive this time, also having central sleep apnea events, right? So let's take a step back. When he had the sleep study 9 years ago, he stopped breathing 74 times an hour. Now, when we put patients on PAP machine, the goal is for their sleep apnea to be resolved. And that means when the AHI is less than 5. But this patient was still having significant sleep apnea symptoms such that on the PAP machine, his residual AHI was 31. Now, so for those of you who don't know how we classify sleep apnea in terms of severity, any sleep apnea AHI greater than 30 is considered severe. So yes, he was severe when he was diagnosed, but on the PAP machine, he is still severe. And had it, if someone had followed him all these years, that would have been found, and maybe pressure changes would have been made, or PAP type changes would have been made to help resolve sleep apnea. Not only did he have severe sleep apnea, he also had a significant portion of that sleep apnea being central. So something in his brain was not triggering breaths or telling the lungs to take breaths. So I want to encourage providers to please have their patients checking with a sleep doctor who would make sure that they're well treated for sleep apnea. Because guess what? For the past 9 years, this gentleman had been walking around wearing his PAP machine, thinking that he was treating himself for sleep apnea, but still had significant sleep apnea because no one was looking at him. All right, guys, I hope this has helped you. This is Dr. Anokwute, sleep medicine specialist. I'll see you in my next video. Bye.